Hello, Sarah. My name is Philip Rulo with Rultract, and I am the product support specialist. What I would like to do is go over some of the options that you and I have been emailing back and forth about. Now, in your last email, you asked if the 28CS double bend bottom post has been discontinued, and you'd mentioned that you use it for bariatric patients, which makes sense because you had also asked for a quote for the 32CS, which, as you can see, would not provide as much space. So we did have this double bend bottom post available because it did create more space for bariatric patients. However, mattress pads got taller, patients got bigger, and this was not as effective anymore. So what we did was we replaced that with a single bend bottom post. So this bend continues all the way, this geometry continues all the way up through the top post, which provides significantly more space than even the 28CS that you had inquired about. And the other thing is this post configuration with the new top post is going to provide additional height as well. So you'll have room for the patient's shoulder, the larger patients, and you'll have more height over the patient, which is also beneficial, of course. So a couple of quick things. I had said that we have other options to consider when purchasing a Rultract for the first time. Obviously, we're not going to do the 32CS straight post for obvious reasons. We do not have the 28CS available, but we do have other clamp options. So you have this bottom post clamp. This is what we refer to as a scrub applied clamp because the tightening knob is on the top. The scrub used to be able to tighten it. I'm sure that's not the case in most hospitals anymore, but it is called a scrub applied bottom post clamp. Now we have a circulator applied bottom post clamp as well with the tightening knob on the bottom. So the circulator would tighten that. As you can see, this is one piece. The bottom post goes into the clamp itself, as well as the scrub applied is the same way. This is one piece welded together. Benefits of this, if you were to put it on the table like so, then the diffusionist or circulator could go under the table to tighten it, squeeze it together and then tighten it. With the scrub applied, I've seen surgeons put it on the rail and then with a glove tighten this knob. Now whether or not you can do that in your hospital, I don't know. This will depend on OR protocol. So obviously we have a tightening knob on the top. We have the option of a tightening knob on the bottom. If neither one of those seem to work for your OR, we have the combination clamp, which is a standalone clamp, and it works with the 28CS-01, the new post that provides more space for the obese patient as well as providing more height. The nice thing about the combination clamp, the reason we call it combination clamp, it can be put onto the bed rail with the tightening knob on the top, or it can be put on with the tightening knob on the bottom, depending on OR protocol. You can also put this onto the bed rail before the patient comes in the room. This can actually stay in the OR as long as it's treated like a stirrup holder as far as sterilization goes. The way that we recommend doing it is to have it sterilized and then put on the table, and then to have the bottom post put into the clamp, however the hospital OR decides to do that. And then you would tighten this down. So the option, obviously, to have the tightening knob on the top or the bottom is beneficial. Some ORs like to have this one piece set up. They think it's easier to set up. So those are the options. And then, of course, you're going to put your top post on. And as you can see, we continue this bend all the way up. So we have additional height, additional space for bariatric patients. I am going to quote you all three systems. I will include pictures of the equipment in all three quotes. So then, of course, you could decide which of the three works best for your OR. And then if you need the additional pieces, we can figure that out. But this is going to be your universal system. It's going to work for small patients. It's going to work for obese patients. It's going to work for large barrel-chested patients. So this should be the only system that you need, whether you use the combination clamp, the scrub-applied clamp, or the circulator clamp. So I think I even confused myself a little bit on that one. Hopefully it made sense to you. Of course, you and I can talk, email, text, either way. Thanks for taking the time to watch this video, and thank you for the interest in our equipment and the years of support. Have a good day.